Hi, everyone. We're going to give everyone a few minutes to get logged on. All right, everyone, we are up and running. On your screen, you see a code. That code is going to give you access to the game. So you'll need to either have the Kahoot app downloaded, or you can use the website kahoot.it, enter that code, and then you'll be ready to play. We're going to give everyone about 5 to 10 minutes to get logged in, and then we'll be ready to rock and roll. I see our returning champ AA is back for more in this fall version, this Halloween version of oral pathology trivia.
Steve, how we doing?
We're doing great. We are ready to go and
Great
excited.
to
This
see
is
you.
this is monumental. This is the first live streamed trivia.
That's true. This is the first live stream. This is a big night. I'm reposting the happening now one onto my story. Excellent. That's up now.
Although it's not showing up on it looks like it's not showing up on YouTube though. I've got YouTube pulled up. Can they hear me testing, testing, testing. Looks like let me see.
Oh, I just saw that you texted me. Got it.
We've got confirmation that we are live on YouTube. But there is a little delay. So we'll warn everyone playing on YouTube that if they're watching at home and they're spectating, that's okay. But if you want to play the game and you want to have the best chance of winning, you might want to pull up Zoom. If not, you can still play along on YouTube as well.
This is awesome that we got the October Halloween background. That's pretty cool.
Oh, just wait. This is a Halloween themed Kahoot. So all of the questions are Halloween themed.
Oh,
A little hint for everyone joining in that wants to do some last minute cramming, but the questions are Halloween themed.
Steve, do you have like a specific name for your YouTube channel?
Nope, just my name, Stephen Roth DDS.
With DDS, got it, got it. And the Instagram handle's the same thing, correct?
Yep, yep. In fact, YouTube now has handles, so if you use the Instagram handle on YouTube, it'll take you to the channel.
Really? Let's see. Stephen Roth DDS. This is excellent too, because all the listeners, everyone in today, they can utilize your platform for studying, for oral pathology, for learning new syndromes, new ways to diagnose lesions. I mean, we could go on all night, but okay. So at Stephen Roth DDS, let's see. Yep, there we go. There it is. Amazing. Excellent.
We're going to start in 3 minutes, everybody. We want to give everyone a chance to log in and to get that code up and running. All right. It is 10 minutes after the hour. We'll get ready here soon. I figured we'll start with a little introduction and allow the stragglers a few more minutes to get logged in using that game code. Dr. Gallagher, do you want to say a welcome to everybody?
Yes, thank you. Thank you, Steve, Dr. Roth. And thank you so much for helping us out tonight, having you on here and doing these. These are fun. These are fun. I always love these. And I hope everyone joining in too. I still got to pick a nickname. I usually go with Dr. Appa because I think that's funny, but I'll have to pick something else this time. First and foremost, well, I introduced you. So second would be that we're a part of the Students Dentistry team. Thank you everyone for coming on tonight. Kayla, we were just talking about the codes and like to get on. The Pre-Dent Mentor Map is a new and recent development that we've had. It's a website to allow free access to resources for pre-dental students applying to dental school. The next step will be dental students applying to residency and so on and so forth. If you could please, if you are a current dental student, you can reach out to me, reach out to Sarah, reach out to Sean, any one of us, and let's get you on there if you can. If you're a current dental student, to help mentor pre-dents. And if you're a pre-dent, please visit that website. We have real-time live data of all the dental schools in the United States. I think we got like 2 or 3 left since there are 5 or so added in the last year, 2 years. But nonetheless, Dr. Roth, thank you so much. Let's take it away.
Yeah, absolutely. And thanks again to Pre-Dent Mentor Maps as the official sponsor tonight for helping us out. And let's get ready to roll. All right. Trivia for fall of 2023, our spooky, scary Halloween theme. But first, if this is your first time, welcome. There are 15 multiple choice questions to test your oral pathology skills, and tonight will be a test. If you've seen any of the previous trivia, there were a mix of difficult and easy questions. Well, tonight might be a little challenging. So I think we're going to have some challenging questions here to really test your skills. And guess what? Every question has a special Halloween theme and some spooky questions heading ahead. Time and accuracy are important, and you have 20 seconds per question. The faster you answer the question, the more points you receive. This only works if you answer correctly, so cheating does not benefit you, as you want to make sure that you answer as quickly and as accurately as possible. Thanks again to Pre-Dent Mentor Map for sponsoring. Another warning I did put in the chat, but if you are live streaming from YouTube, there is a little delay. In the YouTube chat, I put the Zoom code so that you can join us on Zoom. Of course, you can play along, but you might just be a few seconds behind. And with that being said, I'll show our socials. These are where you can find us: Doses Dental Podcast, Top Dental Practices, Elite Dentist, Students of Dentistry, Stephen Roth DDS, and Dr. Gallagher. I didn't put yours on there, but maybe you could throw yours in the chat. I think I had it last time, but that way you can direct message Dr. Gallagher as well to make sure you are on that Pre-Dent Mentor Map. And we will start with a poll. This is our nice little practice round. This does not count for any points, but which option best describes you? Are you a practicing provider, a resident, a dental or medical student, a pre-dent, pre-med, or other? This is for 0 points, but just to make sure that you've got a handle on how this works and to help us understand our audience and who is here tonight. Let's see what we've got tonight. A lot of dental and medical students, that's great, as well as some pre-med, pre-dent, and others. And the resident and practitioners are the lowest number, which is great. That means that these difficult questions will go to some real learners here. We're going to learn a lot tonight. So don't be discouraged if you don't know the answer. I made it especially challenging tonight for the Halloween version. Please know that in future, we'll have a good mix of challenging and easy questions, but tonight I wanted to have a little spooky theme for some fall fun. So with that, let's check out our spooky theme. With our first question, what type of cells are these? Let's take a look at these cells. Here's a photomicrograph of these cells. Are they vampire cells, ghost cells, zombie cells, or werewolf cells? some spooky options with one correct spooky answer. Starting off with a little microscopy. Let's see how we did here. These are ghost cells. Yes. So we saw in that photomicrograph what looked like cells that were missing their nucleus. Because of that, we call them ghost cells. They were once alive, but now they're dead, and their souls stick around to haunt us under the microscope. These were ghost cells. So let's test our knowledge of these ghost cells. But first, let's see how things shook up. Anastasia taking an early lead. AA in third place, our reigning champ, coming back in. Ghost cells are found in what odontogenic lesion? Lesions in the jaw. Is it the OKC, odontogenic keratocyst, ameloblastoma, the calcifying odontogenic cyst or COC, or the lateral periodontal cyst, LPC? This photograph is a case that we had in our practice of this lesion, that we saw ghost cells under the microscope, and we were able to make the diagnosis of calcifying odontogenic cyst. Very good. Very good. That's excellent. We've got 8 people with that right answer. Perfect. But yes, the calcifying odontogenic cyst, or COC, has ghost cells in it. The others do not. Oh, we got a little shakeup here, but Anastasia solidifies that lead. Congrats to Madeline, up 4 places, the highest climber on that question. Question number 3, what eponymous name is used as a synonym for COC? Gorlin cyst, Pinborg cyst, Gardner cyst, or Breslow cyst? Eponymous is something named after someone, using the name of someone. All of these are the names of actual practitioners, but which is the correct one? Gorlin, Pinborg, Gardner's, or Breslow? Let's see how we did. When in doubt, answer Gorlin. It's almost always Gorlin. The Gorlin cyst, or the COC, is not a part of Gorlin syndrome. This is what makes eponyms so annoying. Gorlin syndrome has odontogenic keratocysts, or OKC, as a component. Gorlin cyst is the COC, in which we see ghost cells. So let's make it a little bit more confusing by throwing Gorlin's name on just about everything. An excellent practitioner, an excellent oral pathologist, an excellent dentist who made a lot of contributions to science and to the field of genetics. This cyst was named for him. Pinborg cyst is not a thing, though there is a Pinborg tumor, the calcifying odontogenic epithelial tumor. Gardner cyst was made up because we have a Gardner syndrome, and Breslow cyst was also made up. Dr. Breslow studied melanoma, but Gorlin cyst was the correct answer. Gorlin cyst, not a part of Gorlin syndrome. Let's keep on going with question number 4, but first, 3 players are on a hot streak with the right answer. Congrats to them. But we didn't have a lot of movement in our top 5 leaderboard, but congrats to those 3 that have scored 100% so far on this challenging question. Next up, ghost cells can be found outside of the jaw, and they are seen in this brain tumor. And what is this brain tumor? Let's take a look at the MRI. Here we've got a calcifying, a mixed lesion around the area of the pituitary gland. Is this a medulloblastoma, pilocytic astrocytoma, glioblastoma multiforme, or craniopharyngioma? They call this a suprasellar tumor. It is the craniopharyngioma. Wow, I am impressed. 6 people got that right. The other 3 are indeed brain tumors, but they don't have ghost cells found inside of them. Craniopharyngiomas also happen in this location in the area of the pituitary gland, whereas the other 3 are found outside of this region. So if you see ghost cells in the area of the pituitary gland, think craniopharyngioma. They also display ghost cells and have very similar genetic markers as that seen in the odontogenic lesion. Oh, Ocampo, up 6 places. Way to go. Way to go. And a shakeup on our leaderboard with JJ taking a lead and Asham in 2nd place. But Anastasia holding on to the top 3 there. Let's keep on keeping on. Just when you think we were done with ghost cells, what skin tumor has ghost cells? Here's a picture of it. Is it a cylindroma, a syringoma, a pilomatricoma, or a sebaceoma? All of these are real skin tumors, but only one of them has ghost cells. Don't worry, this is our last ghost cell question, but indeed, the pilomatricoma, yeah, we trick some people with the sebaceoma. Sebaciomas are all blue, but pilomatricoma has ghost cells in it. And in fact, when we look at all three of these lesions under the microscope and you wouldn't tell me the location, I may not be able to tell the difference between them under the microscope. That's why history is so important, as well as imaging and location. So a pilomatricoma, a craniopharyngioma, and a calcifying odontogenic cyst or a Gorlin cyst all have ghost cells. And they all look very similar, very spooky. JJ, on fire. You have the highest answer streak of 5. I think that's 100%. That's excellent. Anastasia, though, creeping back into the lead with that second place steal. Welcome to the leaderboard, Richie. Richie back on top. Come on in. All right. What medication is most likely to cause medication-related osteonecrosis of the jaw or MRONJ? Denosumab, amlodipine, cyclosporin, and phenytoin. Sticking with our spooky theme, MRONJ is dead bone that is still around. So we're being haunted by dead bone and the use of a certain medication or certain medications. Only one of these is known to cause that, and that is denosumab. Very good. Denosumab is a monoclonal antibody used to help prevent bone remodeling. This is often used in cancer patients to prevent bony metastasis from growing, as well as osteoporosis. Amlodipine is a blood pressure medication that can sometimes cause a hypersensitivity. Cyclosporin is an immune suppressant that can cause gingival overgrowth. And phenytoin is an anti-seizure medication that also can cause gingival overgrowth. So all of these are known to have oral pathologic manifestations, but only denosumab has been well documented as a MRONJ precursor. This patient had implants placed. We don't know when they were placed, if they were placed before or after this patient received bisphosphonate therapy, but hopefully, or actually denosumab is not a bisphosphonate, but anti-resorptive therapy. Hopefully these implants weren't placed after. You don't want to do any extractions or any implants in patients that have received this medication. Otherwise, you're putting them at a high risk of developing this MRONJ, this dead bone that can really haunt us. It causes a lot of issues for these patients, including pain and infection. So you want to avoid it if you can. Look at Powell climbing up 6 places. You love to see it. JJ staying in the lead and solidifying it 1,000 points ahead of the rest of the field. Asham taking 2nd place and Anastasia keeping on that top 3. Simrat and Ocampo, I believe you are both new to the top 5 after last round. So we've got a close game. Still shaking up anyone's game. Myiasis is an infection of tissue with which of the following? Brain-eating amoeba, fly larva, cryptococcus fungus, or giardia. All of these are pretty horrifying, but myiasis is an infection with only one of these, the scientific name for infection of tissue with one of these. Let's see how we do. Pretty horrifying, but indeed it is fly larva. What happens is often dead tissue is around, and just like you would expect in a dead body, fly larvae and fly eggs can be laid in dead tissue and lead to growth. It can actually feed on tissue, causing a lot of death. The only time I've ever seen this is unfortunately in a patient that was comatose, had their mouth open, allowing flies to lay their eggs in their tissue, which was already immunosuppressed, and it caused growth of fly larvae. These patients are often very, very sick, but it is pretty horrifying to see fly larvae in a patient's tissue. Something to haunt your dreams tonight, myiasis. I didn't include any photos. I debated it, but I figured that if you're brave enough, you can always Google that term, myiasis. Ocampo with a 4-question streak, and the top 5 remains the same, with Ocampo taking quite a bit of points to close that gap a little bit. But we have a tight gap between first and second place here, only 300 points. So it's anyone's game. We can still mix it up. About halfway there. 8. Which of the following organisms causes cat scratch disease? Is it Burkholderia thailandensis, Teniasolium, Bartonella henselae, or Naegleria fowleri? I'm certainly not a cat person, and this is another reason why maybe you won't be either. But cat scratch disease is caused by Bartonella henselae. Great. This is the question with the most correct answers, I believe, so far. That's great. Burkholderia thailandensis is a serious infection that is becoming more and more widespread recently in the news. Teniasolium is actually tapeworm. That is the tapeworm. And Naegleria fowleri is that brain-eating amoeba that I alluded to earlier. But yes, Bartonella henselae causes cat scratch disease in patients. In case that wasn't horrifying enough, I'll show you the next question, but not a lot of movement there. But we got Asham with a 3-question streak, and Ocampo pulling ahead into 4th place, but not a lot of movement in our top 5. Still plenty of questions left, and those gift cards are up for grabs. What other disease can cats carry, in case the first wasn't scary enough? Psittacosis, toxoplasmosis, tularemia, or Mycobacterium marinum? If you've got a cat, you've got to be careful with cat scratch and another disease. That's right, toxoplasmosis. In fact, toxoplasmosis is the reason why if you are pregnant, you should not change cat litter. There is a chance that you can get toxoplasmosis, which can cause serious issues in pregnancy and to the fetus. Psittacosis or ornicosis is caused by birds, tularemia by rabbits, and Mycobacterium marinum by fish and fish tanks. If you want to learn more, I would recommend subscribing to my YouTube channel. My next video this month for Halloween on our spooky diseases are on how our pets are trying to kill us. And we'll go into these and more, and all of the ways that our furry friends can give us these really nasty diseases. AA coming back in, sneaking into that top 5, coming back to hold on to that title. But it is tight. Look at this. The 3rd, 4th, and 5th place are all within striking distance, all within, about 300 points of each. JJ keeping a solid lead here. Number 10, which stain highlights the thick capsule of Cryptococcus neoformans? This is a fungus. I liked it because of the word crypt in it. Is it mucicarmine, hematoxylin, eosin, or trichrome? Which stain highlights the thick capsule of Cryptococcus neoformans? A specific type of fungus that often happens in the Southwest Ohio State, or not Ohio State, it's the Southwest United States. It is indeed mucicarmine. The thick mucus capsule around the Cryptococcus organism can be stained with mucicarmine and looks red. In fact, this is what it looks like after we get our recap. Oh, we had someone drop out of our top 5 and Simrat coming back in. It is a grueling match here at the bottom of our top 5. It really is kind of a fight for 3rd place, and our 1st and 2nd place haven't been shaken up yet, but it's still early. There's still plenty of questions left, and everyone is doing great. Congrats to JJ with that 3-in-a-row streak. Let's take a look at those Cryptococcus stained with mucicarmine. Here you can see the outside crypt of the organism. It looks a little bit like a donut or a Cheerio. that thick capsule stains with mucicarmine. That is one way that you can differentiate it from other fungi, is that you can stain with mucicarmine. Mucicarmine, by the way, is made from crushed up beetles. It is a stain made from crushed up beetles, so that's pretty horrifying as well. Which condition likely led to the mythologic creature known as vampires? Is it Cowden syndrome, congenital erythropoietic porphyria, pituitary hyperplasia, or Lederer-Seewey disease? If you've tuned into trivia in the past, you might have seen questions about this condition before. So thanks to all our returners. A good way to study up is repetition. Indeed, it's congenital erythropoietic porphyria. Pituitary hyperplasia can actually call gigantism, and Lederer-Seewey disease is an outdated term for Langerhans cell histiocytosis. But indeed, congenital erythropoietic porphyria is also is potentially where the mythologic creature vampire came from. Oh, Anastasia back up, fighting for that third place spot, trying to take Ocampo down, but Ocampo's got that 8 correct questions in a row. That's incredible. That's incredible. Someone knows their oral pathology. That's wonderful. So why do we call congenital erythropoietic porphyria vampire disease? Well, the condition itself causes dysfunction and destruction of heme, which is what makes up hemoglobin. Because of that, there are a lot of different presentations and side effects of the lack of that blood product. The first being sensitivity to sunlight. These patients, when exposed to sunlight, can develop painful red skin as well as burns from being out in the sun, which is where the idea of vampires only coming out at night comes from. The other suggestion that they, quote, drink blood, close quotes, is because their urine can appear red. This is because that breakdown product is deposited in the urine, and when the patient urinates, you can actually see red when they urinate. In fact, if you check out last season's trivia game, I showed pictures of the urine. All of these trivia games previously and moving forward are posted in my YouTube channel in a very convenient playlist. So after the game, feel free to check that out if you want to see the red urine that actually glows under black light. The other thing is that the sulfur in garlic can lead to acute stomach pain in these patients, that the sulfur in garlic doesn't mix with the lack of heme and hemoglobin, which leads to acute distress, which is why these patients avoid garlic. And then finally, the fangs, or the altered teeth, are tooth anomalies observed in this condition. So the thought is that all of these different presentations mixed together might be where the mythologic creature of the vampire comes from. Speaking of those tooth anomalies, congenital erythropoietic porphyria leads to discoloration of teeth. What color teeth do these patients have? Red, blue, yellow, or green? Red, blue, yellow, or green? Both a previous question, and we'll see if you were paying attention to that rundown there. Indeed, red. Red, the breakdown heme ends up becoming deposited within the dentin of teeth, leading to red discoloration of teeth that also glow under black light, similar to the red urine. So they glow a different color under the black light. But indeed, red teeth. I'm not familiar with any blue teeth discoloration other than perhaps tetracycline staining that's kind of a blue-gray. Yellow is usually after trauma, and green can happen in certain liver diseases like biliary atresia. Pow, up 3 places. Way to go. Look at this. AA back on the podium, and a shakeup in first place. Asham up in first place. Look at this. We had a lot of movement going on here. That's great. This is an exciting game. Can JJ reclaim his spot? Will Asham hold his lead? Will AA come back from behind and retake as a two-time winner? By the way, we have not had a two-time winner. Our first place champ has not reclaimed that spot yet. So we'll see if AA will be the first. Here, by the way, is a patient that came through our practice. I do apologize for the blurriness, but you can imagine that getting pictures in a young child, an infant, can be difficult, but you can appreciate how red these teeth are. This patient underwent genetic analysis and indeed was confirmed to have congenital erythropoietic porphyria. Congenital, by the way, means from birth. So these patients start having symptoms from birth. You have to be very, very careful with these patients and sun exposure because they can burn very easily. And it's important to get a diagnosis early. 13, an increase in hair in unexpected areas is known as which of the following? Is it hyperfolliculosis, hypersebaceosis, hypertrichosis, or hyperadnexosis? We're coming down to the wire here with only 3 questions left, including this one. You can see that this is sometimes called werewolf disease. But indeed, it is hypertrichosis. This was a little tricky for everybody, but yes, hypertrichosis is the official medical terminology for an increase in hair, especially in unexpected areas, as you appreciated in that last photograph. Hypertrichosis. Everything else was made up to sound like it was correct, trying to be a little tricky, but hypertrichosis. Congrats to the 6 people that knew that. Coming into our last 2 questions, let's see what our leaderboard looks like. Wow, not much of a shakeup, but congrats to Carolina. Carolina with a streak of 7. Way to go, Carolina. That's impressive. That's impressive. Our top 5 remains the same. Everyone got a few little points. Look at this. We've got less than 100. We got about 150 separating our second and third, and a close match between our first and second place, with 4th and 5th close behind. So it is tight. Going into our penultimate question, hypertrichosis is a component of Ramon syndrome. What jaw lesion is a part of Ramon syndrome? Here is a radiograph, a CT reconstruction of a patient with Ramon syndrome. Is it ameloblastoma, central giant cell granuloma, myxoma, or hemangioma? We've got some slow answers trickling in. This is a hard one. Ramon syndrome, not talked about very often, but indeed it is the central giant cell granuloma. Very good. You may have noticed that radiograph looked very similar to cherubism, and that's because they both present with bilateral and enlarging central giant cell granulomas. All right, going into our final question. Let's see what we got. Oh, wow. Look at that. AA reclaiming her spot on the top of the leaderboard, but not safe at all. We've got only 17 points separating AA from JJ. The battle of the double letters, AA and JJ, with Asham close behind in 3rd, and a really tight 4th place with Anastasia bumping back up close to that podium, nipping at the heels. This is a really exciting, this is probably the closest of all of the trivia matches that we've done so far. So this is really tight, really anybody's game here going into the last question. So this is pretty exciting. Let's see who wins our gift cards. But first, we've got one last question. But before that, let's talk a little bit about Ramon syndrome. This is the patient from the article from which I took that radiograph. Ramon syndrome is characterized by bilateral giant cell lesions, similar to cherubism, hypertrichosis, or that excess hair, gingival fibromatosis, or gingival overgrowth, developmental or intellectual delay, epilepsy, optic atrophy, or atrophy of the eyes, hearing loss, and lots of other manifestations, but these being the most common. All right, here we are. coming down to our last question. Our last question. So get your thumbs on the ready. And let's take it away. What is this tooth anomaly, sometimes called ghost teeth? Is this odontomaxillary dysplasia, regional odontodysplasia, submaxillary hypoplasia, or enamel hypoplasia? Ghost teeth, this is a real thing. It's even in the textbook as ghost teeth. You can appreciate that they do kind of look like ghosts. Yep, ROD or regional odontodysplasia are ghost teeth. So, how did this shake up? Who will walk away with that $100 Amazon gift card? Who will come in second for the $50 Amazon gift card? Or third for the $25? Let's find out. But first, of course, I just wanted to remind everyone to follow us on Instagram for updates on our next trivia. And in the chat, you'll see Dr. Gallagher at Predent Mentor Map or predentmentormap.org. Thanks again for sponsoring, Dr. Gallagher. Do you have any parting words on our spooky trivia?
No, just thank you. Thanks everyone for coming out. We'd really appreciate if you could help us with the Predent Mentor Map. I did put it in the chat. You could always DM me. I'm always here. I like the podcast a lot. Dr. Roth likes the podcast a lot. We like content a lot. We'd be super excited if you could help us out with the map. Signing on as a current dental student to help mentor. Otherwise, pre-dental students it's all free on there. The resources are yours as we continue to build and expand and make it more resourceful for you. Dr. Roth, these events are great. I love these. What a spectacular background. Every diagnosis, every syndrome, everything on here was very on point for the season. Love this.
I did what I could. So yes, a reminder to check out Predent Mentor Map. It'll also be in the description of this video on my YouTube page, which will be saved for you to watch later if you want to relive the excitement and the action at some later date, or perhaps brag about your victory if you were the winner. Should we find out who the winner is? Let's do it. Here we go. In third place, Asham with 9,000. Did we break into the 10? 9,400 AA with that means, could it be JJ squeaking out a win? Look at that, squeaking out a win. I've never seen a game that close. What is that? That is 26 points separating second from first. That is brutal. That is a tight game. Good work to all. I hope that you had a wonderful time. I do apologize that my camera wasn't up and running. I saved everyone from that kind of horrifying thing of seeing me while I spoke. But thanks again for coming to everybody on the podcast or the Zoom here. If you were in the top 3, do us a favor and either send us a DM on Instagram or put your email in the chat of this Zoom, which I'll be closing out shortly. But if you could please either DM myself, Dr. Gallagher, or Predent Mentor Map at Predent Mentor Map in the chat, predentmentormap.org. If you could DM one of us so we could get you your gift cards. Again, thank everyone for coming out. Happy Halloween, and hopefully we will see you in the winter. Be sure to tell your friends if you had a good time, and be well.
Yeah, let's try and get those. Try and get those in the chat. Let's try and get the emails hopefully